Welcome back. This is Dr. Jin Sung, where clinical excellence meets excellent results. Today we're going to talk about vitamin D and toxicity. Vitamin D is a fat-soluble vitamin, so it will accumulate in your body. I've made other videos on vitamin D, and some of the questions were, how prevalent is vitamin D toxicity? So let's get right into it. So vitamin D supplements are usually patient-driven. That means patients go out and they buy supplements and they go, okay, it recommends 1 drop per day, and they take the incorrect dosage. And over a long period of time, they can develop increased levels of vitamin D causing toxicity. So when you look at it, there are a 16-year retrospective study looking at over 73,000 people, okay? And what they did was they looked at what the levels of vitamin D were in these patients. So most people tested below 80 nanograms per milliliter. So that's well within the lab reference ranges. Usually 100 and below is the lab reference range. I like to see patients between 60 and 80 nanograms. However, most patients in that retrospective study were below 80 nanograms. Now, most patients or within normal limits. However, there were certain populations that had elevated vitamin D level. And the elevation was considered over 120 nanograms per milliliter. Of those patients who had elevation, some of them, only 4 actually, had nausea, abdominal pain, and constipation. That means over 73,000 people they looked at, only 4 people actually had symptoms of vitamin D toxicity. So it's pretty rare to be overdosing on vitamin D. Now, I've seen patients personally in the office where they come in and they took the incorrect dosage. So when you look at your vitamin D supplement, especially the liquid form, it says 1 drop per day. 1 drop is typically 2,000 international units. So my recommendation would be 2 drops per day or 3 drops per day. But what patients misunderstand is they think a drop is a dropper. So they take the whole dropper full of vitamin D for a long period of time, and their vitamin D level will exceed the reference range. So I've seen people come in at 150 nanograms or 175 nanograms. And yet they still didn't actually have vitamin D toxicity symptoms. Now, that's why I always stress the fact that you should test your vitamin D levels. Start from the baseline, what is it in the beginning, supplement, and then recheck in 4 weeks to see where your levels are. And then you have to determine what your maintenance dosage is going to be. Usually maintenance will be between 4,000 and 5,000 international units. But depending on your body type, how big you are, your maintenance dose can go up to 10,000 international units. So that's going to be specific to each individual person. So it's very important to check the levels before you supplement, and then check after you supplement to try to find that fine zone for yourself where you're taking the right amount of vitamin D for long periods of time, okay? My name is Dr. Jin Sung, where clinical excellence meets excellent results, and we'll see you guys next week on the healthy side. Have an awesome day.